Hello everyone, welcome back. Today we are going to learn about types of gait abnormalities. In detail, I'll explain some types of gait abnormalities in this video. Okay. First type of gait abnormality is antalgic gait. Okay, antalgic gait is a walking pattern adopted by a person to minimize pain in one leg or a foot. In this gait, the patient spends less time on the painful leg and quickly shifts body weight to the normal leg. Okay, and this is also known as a painful gait. So causes for antalgic gait are the a wide range of conditions can lead to antalgic gait, including injuries like fractures, strains, and other soft tissue injuries. This is first cause, and inflammatory conditions like arthritis, bursitis, and other inflammatory disorders. Next, infections, that is bone or soft tissue infections. Then nerve compression is also can lead to antalgic gait like sciatica or any other nerve impingements. Then other conditions like tumors, vascular issues, or any other medical problems. So this is antalgic gait. So in the next picture, in the next slide, you can see the picture of antalgic gait clearly. So refer that. Second one is step age gait. It's also known as neuropathic gait or a foot drop gait. Okay, so it's a walking abnormality is characterized by an exaggerated lifting of the leg to clear the foot during the swing phase of the walking. Okay, so the this is caused by several causes. So typically due to an issue with your nerves and muscles. The most common cause is lumbar radiculopathy and peroneal nerve injury, and other causes may include brain conditions. Okay, just remember this lumbar radiculopathy and peroneal nerve injury. So in the next image you can see the step age gait, how they are walking, that is foot drop gait. They are walking in like that. So third one is ataxic gait. It's also known as cerebellar gait. So it's a type of gait abnormality characterized by a lack of muscle coordination. Okay, leading to unsteady, staggering, and often wide-based movement while walking. So it's commonly associated with the cerebellar dysfunction. So causes, I already said cerebellar dysfunction. So ataxic gait is most frequently associated with cerebellar disorders which affect coordination and balance. Okay, the function of cerebellar is coordination and balance. So it's only affected then cerebellar dysfunction. So ataxic gait can be seen, and other causes are the neurological conditions or any sensory ataxia also there. That is a damage to sensory pathways can also result in ataxic gait, where proprioceptions, that is awareness of the body position, is impaired. So certain medication can also affect our gait and causes ataxic gait. The side effects of some medication can cause this type of gait. Okay, so you can see in the picture how the person is standing with broad base support in the ataxic gait condition. So next type of gait is Caesar's gait. So it's also known as diplegic gait. So it's a walking pattern where a person's leg cross over each other at a knee and thigh during each step. So resembling the action of scissors opening and closing. So you can remember the example of scissors opening and closing for this Caesar gait. In the name itself is there. And the causes, what are the causes is cerebral palsy is the main causes, because cerebral palsy that primarily affects the lower limbs. Okay, in the children. So you can see this also, Caesar's gait in the cerebral palsy. And spasticity, like increased muscle tone or spasticity in the hip adductors, that muscles that brings the leg together, right? So they are underlying causes of the leg crossing. Then other neurological conditions may also affect this type of gait. Okay, so you can see in the picture how the person is standing, and in the other picture the person is going to walk, but it looks like a Caesar opening and closing look, so it's named as a Caesar gait. So next one is spastic gait or hemiplegic gait or a circumduction gait. So the popular name is circumduction gait. Okay, so remember that word. So it's a walking abnormality characterized by stiff or a jerky movements due to increased muscle tone. So often seen in condition like cerebral palsy and multiple sclerosis. Okay. So causes, you can see spastic gait is often symptom of neurological conditions. Okay, it affecting the brain or a spinal cord such as cerebral palsy, multiple sclerosis, and damage to the brain from the stroke can affect. Then spinal cord injuries. Otherwise, hereditary spastic is also included. So you can see in the picture how the person is walking. He's drawing a figure of zero with his in his leg by while walking. So look at his walking ability. Okay. So next one is Trendelenburg gait. So it's an abnormal walking pattern caused by weakness in the hip abductor muscles. Okay, primarily the gluteus medius and minimus muscle. So they can affect this Trendelenburg gait. So causes the muscle weakness. I already said the weakness or dysfunction of the hip abductor muscle, especially gluteus medius and minimus. Okay, then neurological condition can also lead to Trendelenburg gait, like cerebral palsy and all. Then hip injuries like dislocations, fractures, or any other hip related conditions also lead to Trendelenburg gait. So then arthritis, then leg length discrepancies also affect this gait. Okay. So you can see in the picture how the person is walking because of his weakness in the hip abductor muscles. Okay, the walking pattern will affect. So next one is waddling gait or also known as myopathic gait. Okay, it's a type of abnormal walking pattern characterized by a side to side swaying motion. So often described as a duck like or a pigeon like walk. Okay, remember that duck like or a pigeon like walk. So causes for this type of gait is muscular dystrophy. So various form of muscular dystrophy are there can lead to this waddling gait. Then myopathy is muscle weakness. Okay, myopathy means muscle weakness can also cause this weakness of the hip muscle, so resulting in waddling gait. Then hip dysplasia is a condition like congenital hip dysplasia where the hip joint is not properly formed, so can affect stability and lead to waddling gait. You can see in this type of gait in daily life. So many people are having this type of gait. They walk like a duck or walk like a pigeon. So that is known as waddling gait. And also pregnancy. The pregnancy, the hormonal changes and shifting center of gravity during pregnancy can also lead to waddling gait. Okay. So you can see in the picture how the person is walking with waddling gait, is walking like a duck or a pigeon. Okay, remember waddling gait is walking like a duck or a pigeon. Okay, it's also known as myopathy gait. So next type of gait is crouch gait. So it's defined as a excessive ankle dorsiflexion, knee and hip flexion during the stance phase. So this gait disorder is common among patients with cerebral palsy. Okay, so the dorsiflexion of the ankle you can see more, and also the knee and hip flexion is also excessive. Okay, so causes, I already said cerebral palsy patient and also muscle weakness, and then muscle imbalance patients also get this type of gait, and the joint deformities can lead to crouch gait, and also rapid growth, increased height can also lead to crouch gait, and any other musculoskeletal deformities like pes valgus, external torsion, like that. So, okay, so you can see in the picture how the person is walking with his excessive ankle dorsiflexion and also knee and hip flexion. Okay, during stance phase you can see. Okay, next one is Parkinsonian gait, that is also known as a propulsive gait or a fascinating gait. So it refers to the characteristic walking pattern associated with Parkinson disease. Okay, Parkinson disease, particularly in later stage. Okay, stages. Then it's often described as a slow shuffling step with reduced arm swing movement is reduced, and also difficulty initiating or changing direction. It's very difficult for the patient, like Parkinson disease patient. Okay, so causes, maybe dopamine deficiency can lead to Parkinson disease. You guys know that Parkinson disease involves the degeneration of the nerve cells in the substantia nigra, so a part of the brain that produces dopamine. So dopamine is a neurotransmitter that helps transmit signals for smooth and coordinated movements. Okay, that will, if that dopamine is deficient, dopamine deficiency can lead to this Parkinsonian gait. Then basal ganglia dysfunction, uh, then motor symptoms, then bread, like what and all symptoms you can see. The loss of dopamine in Parkinson disease leads to range of motor symptoms, including bradykinesia, that is slowness of the movement, then rigidity, that is stiffness of the muscle, or tremor. Main symptoms is tremor, so involuntary shaking. Okay, then often at rest. Okay, rest also they are shaking in that. So this is Parkinsonian gait. So you can see in the picture how the person is walking, is slowed movement, reduced arm swing, rigidity, is freezing, and postural instability. Next one is apraxic gait. It's also known as a gait apraxia. So it's a neurological condition characterized by the inability to properly execute the learned movement needed for walking, or despite having the physical capacity to do so. So causes affect like frontal lobe lesions or tumors, that is structural damage in the brain. Then the main cause is normal pressure uh, hydrocephalus. Okay, that is a buildup of fluid in the brain. Okay, often presenting with the triad of symptoms: walking difficulty, cognitive decline, and incontinence. Then dementia and strokes, that is a damage from restricted blood flow to the brain. Then neurodegenerative diseases, conditions like Alzheimer's disease or a corticobasal degeneration. So you can, that is apraxic is a type of neurological condition that is the inability to properly execute the learned movement that which is needed for walking and all. Okay, apraxic gait. Next one, weak quadriceps gait. A weak quadriceps gait is a abnormal walking pattern caused by insufficient thigh muscle strength. In the name itself, weak quadriceps. Okay, when the muscle get affected, the muscle strength will lose, right? So at that time, this type of gait we can see. So common causes is nerve injury or a neurological conditions, maybe damage to the femoral nerve, or any other conditions like a stroke can impair the nerve signals needed to the quadriceps. Then knee trauma, post surgical recovery, that is ACL reconstruction or a total knee replacement, or ligament injuries frequently cause the quadriceps muscles to atrophy and weaken. So osteoarthritis is also can lead to this weak quadriceps gait. So you can see in the picture how the person is struggling to walk, that is there is weak quadriceps, right? So line of gravity, that is anterior to medial lateral axis of the rotation, you can see in the picture. Next one is hand to knee gait. It's a compensatory walking pattern where an individual uses their hand to push on their thigh or a knee. Okay, mainly knee. This action manually locks the leg into extension to prevent the instability during walking. So causes, again, quadriceps weakness can lead to hand to knee gait. So then knee osteoarthritis or instability, or a fixed knee deformities, like permanent changes to the knee structure, such as fixed flexion deformity, can restrict normal movement. So they can lead to hand to knee gait. So you can see in the picture the person walk by placing his hand on the knee while walking. Okay, next one is magnetic gait. So it's also a neurological symptom where a person's feet feel glued to the floor, okay, making it extremely difficult to initiate or start the steps So it manifests as a slow shuffling walk with minimal foot lift and is most commonly associated with again normal pressure hydrocephalus only. So again causes is normal pressure hydrocephalus. I already said an accumulation of a cerebrospinal fluid in the brain, which is notably one of the few reversible causes for the dementia. Okay, then also frontal lobe lesions cause also lead to magnetic gait. Then vascular dementia, already said. So yeah, you can see in the picture the person is walking uh, with very difficulty, is shuffling gait with short steps, then reduced arm swing, again rigidity and trembling of the head, forward tilt of the trunk. You can see all these, you can notice all of them in the magnetic gait patient. Okay, next one, equinus gait or a toe walking. So it's a condition where the ankle lacks the flexibility to bend upward, that is dorsiflexion. So individuals walk on the balls of their feet or toes because their foot is stuck pointing downward. Okay, only plantar flexion. So it often stems from the tight Achilles tendon or a calf muscle contracture. So causes neuromuscular disorders like cerebral palsy, stroke, or traumatic brain injuries. And then musculoskeletal conditions also like tight gastrocnemius or soleus muscle complex or a Achilles tendon. Then congenital, it can be present at birth or develop later in life due to injury, illness, or a prolonged immobilization. So in the picture you can see the ankle lacks the flexibility to bend upward, right? So only the toes are walking here. So this is equinus gait. Okay. Next one is calcaneal gait. It's also called as flat foot or a heel gait. So it's an abnormal walking pattern characterized by the inability to perform a forefoot push-off movement. Okay, so causes can be a muscle weakness or a paralysis. Again, the damage to the Achilles tendon can lead to calcaneal gait, and trauma, some fractures or injuries affecting the heel bone, that is calcaneus, can lead to this type of gait. The neurological conditions can also lead to this type of gait. Then surgical complications like over lengthening of Achilles tendon during procedures to correct any type of deformity can lead to this calcaneal gait. Okay, you can see in the picture the person is walking like flat foot. So weakness in the plantar flexus can lead to this type of gait. Okay, next one is a choriform gait. It's also known as a hyperkinetic gait. So it's an abnormal walking pattern characterized by irregular, jerky, and involuntary dance-like movements. Okay, so remember dance-like movements for this hyperkinetic gait. Okay, so causes that is Huntington's disease. It's a hereditary disease. Then Sindemann's chorea, it's a complication of rheumatic fever causing rapid, uncoordinated movements, particularly in the children, or any other basal ganglia disorders can lead to this type of gait. You can see in the picture how the person is struggling to walk. He's look like dancing, but is not. So this is the end of today's video. Thank you for watching. So in this video I explained several types of gait abnormalities. There are many more abnormalities, but for now these are most important ones to know. So you can write these notes in your exams, and I'll share the notes in the description box below, so make sure to check them out. So if you found this video helpful, please like, share and subscribe to our channel. If you have any doubts or questions, feel free to ask in comment section. So thank you for watching. See you in the next video.